So I'm Karen Brown, I'm Head of Care here at Beaumont House Hospice Care. I've been doing this role for just over a year, but I've been at Beaumont House for 10 years now. This week is Dire Matters Week, and the theme this year is let's talk about death, let's have conversations about death. So talking about death is something that we do as a hospice to support our patients and their families every day. Having those conversations early is really important, and we like to give our staff the tools and the confidence to be able to start these conversations with her patients and their families. Conversations about death and dying here at the hospice are very much patient-led, and it's very much an individual thing. What works for one person is not comfortable for the other. So it's all about giving that person the time and the space to feel comfortable to have those conversations and asking the right questions in the right way. So all our staff are trained in sensitive communication. So people might feel hesitant about talking about death and dying. It might be the fear of the unknown, but having those conversations can really help to ease those fears. It can help them to understand what might lie ahead, help them to put plans in place that leave them feel more reassured and leaving their friends and family reassured. So things you might want to think about when you're talking about death, anything that's important to you. So that could be where you want to be, who you want to be with you. It could be you want to wear a special outfit, you want a certain type of music. It could be things about, do you want to appoint a lasting power of attorney that can help you deal with your affairs? Have you made a will? As hospice staff, we have these conversations on a daily basis, and it isn't something that we should be afraid of. It can really help people put people's mind at rest. And actually people often want to talk about it, but they don't feel they're confident to speak about it with their families. In actual fact, once they have these conversations, it can really help to reassure them that their family know their wishes and that everything's going to be in place for when that time comes. Working with our patients is an absolute privilege, and helping people to make those plans and have those conversations and really make the most of the quality of their life is what we all come here to do.